counterstraining to the piriformis is one of the best tools you can have in your clinical toolbox. It works really well to help decompress the sciatic nerve if it is being compressed by the piriformis without actually aggravating it. Sometimes stretching the muscle can cause an aggravation. So using this indirect technique, this positional release called counterstrain to the piriformis, you can take the pressure off the sciatic nerve without aggravating it. So let's go to counterstraining the piriformis. The first thing you need to do is palpate for a tender point. A tender point is a point that is defined as 4 times more tender than normal tenderness, and the common piriformis tender point is easy to find if you can find these 2 major landmarks, the PSIS and the greater trochanter. You can find greater trochanter by placing the heel of your hand on the lateral leg, and if you run your hand superior and inferior, you'll feel the bump. That's the greater trochanter. Same thing here. You can use your fingertips or the heel of your hand to find the bump of the PSIS here. Find those 2 bony landmarks, and the spot directly in the middle of those 2 points is the piriformis. Press it, and if it's tender, you can try to use counterstrain to alleviate that tender point. Here's how to put them in a position. You want to grab the leg and take it off the table, and then gently move it forward so the hip's going into flexion. And as you take it off the table, put it on your legs. Right? When you palpate here, you want to see if that gets rid of the tender point. If it does not, you can fine tune it by internally rotating the hip. Notice how I internally rotate her hip by simply lowering my front knee by turning my stool. So I can lower the knee and turn the stool, and then this can further decrease the tenderness of the piriformis. If you find a position that the tender point is decreased 70% or more, then you will hold this position for 90 seconds. The only reason I keep my hand here on the tender point is to monitor it to make sure they are staying relaxed. Okay, they will be relaxed if they feel secure. So make sure you have their leg on both of your legs, and then you are holding this position. After 90 seconds, you are going to passively return them to neutral. This passive return is important as it resets the gamma system that controls the muscle spindle. So you want to secure the leg and then passively return to the neutral position with the leg on the table, and then recheck the tender point. It should be gone. If it is not, or if that was an unsuccessful position in reducing the tenderness of the piriformis, here is position number 2. If you like this video, please share it, and don't forget to subscribe to our YouTube channel. Also, subscribe to our blog at movewellacademy.com, where we constantly upload and update information about pain-free living. Thanks, and we'll see you next time. Have them slide a little more to the middle of the table, bend their knee up and pull their knee out just a little bit to abduct the hip about 10 or 15 degrees, and then let the foot fall in. So this is external rotation with less flexion. This is with the hip extension. And palpate the piriformis here and see if that reduces the tender point. In reality, if this position reduces the tender point, chances are your tender point isn't on the piriformis, but on one of the other deep external rotators of the hip. The reason the piriformis is shortened with the hip in flexion and in internal rotation is because after 90 degrees of flexion, the piriformis becomes an internal rotator of the hip. The other external rotators of the hip remain external rotators regardless of hip flexion or extension position. Okay, so this is a position you can try to eliminate that tender point in the middle of the glute. Hold for 90 seconds and then passively return to neutral. Then recheck the tender point. And don't forget to recheck their function afterwards to see if your manual technique made a difference.